Welcome back to my channel. If you are visiting this space for the first time, you are also highly welcome. In this lecture, we would be looking at the Bartholin's gland. This gland can also be referred to as the greater vestibular gland. We try to use this image by the side. This is where we have the Bartholin's gland here, arrowed in white. We have two of these glands. We have one on the right and we have the other one on the left. The Bartholin's gland is located within the superficial perineal pouch. In this lecture, we'll be describing the features of this gland and also highlighting some details that you should know as students of anatomy. The Bartholin's gland, we say, can also be referred to as the greater vestibular gland. This gland can be referred to as the greater vestibular gland because it is seen around the vestibule. And more so, it is greater because we have a lesser vestibular gland. Going through this lecture, we would be highlighting the lesser vestibular gland. For you to have a greater vestibular gland, you should also expect to see a lesser vestibular gland. If there is no lesser vestibular gland, this gland will just be tagged the vestibular gland. So the Bartholin's gland is referred to as the greater vestibular gland. It is greater because we have the lesser version of this gland, and also vestibular because it is located around the vestibule. We try to use this image by the side. This is where we have the greater vestibular gland here, arrowed at this point. You see we have two of these glands. We have one on the right and we have the other one on the left. And if you look through, you see that this gland is located around the vestibule. The opening around this region where this arrow is pointing is where we have the vestibule. The vestibule is the space that is located between the two inner leaves of the external female genitalia, which are the labia minora. So you have the space created between these two leaves, and deep to the labia minora, we have the bulbus spongiosum. This is where we have the bulbus spongiosum here. It's a paired muscle. We have one on the right and we have the other one on the left. While more superficial to this muscle is where we then have the labia minora. So you see that between these leaves, we have an opening created that is referred to as the vestibule. And now this posterior lateral region is where we have the placement of the Bartholin's glands or the greater vestibular gland. This is the anterior position and this is the posterior position here behind. So you see that it is located around the vestibule. This Bartholin's gland is a two-pear-shaped gland. Is located laterally, and it is seen to be directed slightly posteriorly. If you look at how it is positioned here in this upper image, you see that it is laterally placed and also slightly directed posteriorly. And this is where you see that it is located on both the lateral wall of the vagina canal. This is where we have the vagina canal here, arrowed in black. This is the opening of the vagina canal. And at this upper region here is where we have the opening of the urethra. So you see that the urethra is located in the anterior part, and behind it, we have the opening of the vagina canal. While on both lateral wall of the vagina canal is where we have the position of this Bartholin's gland or the greater vestibular gland. And if you look at this lateral edge that is arrowed here in green, we have the paired bulbus spongiosum. We say that these bulbus spongiosum are paired muscles that are located the superficial perineal pouch. And between these two pairs of bulbus spongiosum is where we have the opening here created that is referred to as the vestibule. Within the vestibule, we have two openings. We have the opening of the vagina canal and we have the opening of the urethra. And this is how it is placed here in this image. It's also important for us to highlight that we have erectile tissue that is located anterior to the position of the Bartholin's gland. If you look at this structure that is arrowed here in white, this is the bulb of the vestibule or the bulb of the clitoris. This is an erectile tissue that is located in the anterior part of the Bartholin's gland. And you see it extending forward anteriorly until when it reaches this point here where we have the glands of the clitoris. The clitoris is a very sensitive part of the female external genitalia, and part of the clitoris also is seen to extend downwards here, and this is where we have the bulb of the clitoris. So you see it extending up to the anterior region of the Bartholin's gland or the greater vestibular gland. As you have this alignment on this side, you also have it here on the other side. So it's important that we're able to highlight it. In case we come across this during our practical examination, we should know that the bulb of the vestibule or the clitoris is seen to be positioned anteriorly to the Bartholin's gland or the greater vestibular gland. This gland is a mucus secreting gland that allows for the lubrication of the mucosal wall of the vaginal canal. And how it does this is by releasing its content or its secret through its duct. So this Bartholin's gland is seen to have a duct through which it releases its secret into the cavity or the lumen of the vaginal canal. We try to use this lower image. This is where we have the Bartholin's gland or the greater vestibular gland, highlighted in yellow. So this gland is seen to have dots that is highlighted here in red, through which the secret is released into the lumen or the cavity of the vagina. This dot is seen to be about 2 centimeters in length and about 5 millimeters in diameter. And you see it opening into the lumen of the vaginal canal at 4 and also 8 o'clock position of the labia minora. So this is how it is directed and finally releasing its content into the lumen of the vaginal canal. This is where it helps to lubricate the internal wall of the vagina. So let's move through the next slide here, where we'll be describing other details that you should know as students of anatomy. This Bartholin's gland, I would say, can also be referred to as the greater vestibular gland, is located within the superficial perineal pouch. If we go back to our lecture on the superficial and the deep perineal pouch, in that lecture, we highlighted that the perineal membrane is the basis onto which these pouches are created. We try to use this upper image here. This is where we have the Bartholin's gland here, arrowed here on both sides. We have one on the right and we have the other one on the left. And we said that this gland is seen to release its contents through a dot that is highlighted here in red. So it is through these dots that they release what they secrete into the lumen of the vaginal canal, where they help to lubricate the internal wall of this region. And if you look at this region here that is harrowed on both sides, you see that this structure looks like a membrane, and this is referred to as the perineal membrane. This perineal membrane is what creates the basis onto which the spaces within the anteriorly placed urogenital triangle is further subdivided into 2 pouches. And this is where we have the divisions into the deep and the superficial perineal pouches. If you look at this membrane deep to it, we have the deep perineal pouch, and superficial to this region is where we have the superficial perineal pouch. It means that this image or this region that is exposed there in this image is the superficial perineal pouch. And this superficial perineal pouch is located within the anteriorly placed urogenital triangle. This is the anteriorly placed urogenital triangle here, highlighted in dotted white, while posteriorly here we have the posteriorly placed anal triangle. If you go back to our lecture on the perineum, in that lecture, we described that the perineum is divided into 2 triangular configurations. We have the anteriorly placed urogenital triangle, that is highlighted here in white, and the posteriorly placed anal triangle that is highlighted here in black. It is within the anteriorly placed urogenital triangle that we have the creation of the deep and the superficial perineal pouches. So superficial to the perineal membrane is where we have the superficial perineal pouch. And it is within this pouch, as you can see, that the Bartholin's gland or the greater vestibular gland is located. And this is what is highlighted or harrowed at this point. It is important for us to know that the Bartholin's gland is homologous to the bulbourethral glands in male, but this gland is located within the deep perineal pouch. Remember when we described the position of the Bartholin's gland, we said that this gland is located within the superficial perineal pouch, and this is an homologous structure to the bulbourethral gland that can also be referred to as the Cowper's gland in male, although this gland is located within the deep perineal pouch. Let's try and use this lower image to describe where the bulbourethral gland or the Cowper's gland is located in male. At this region here is where we have the pelvic cavity. Inferior to the pelvic cavity, we have the pelvic floor or the pelvic diaphragm. And this is what is highlighted here in purple. We know that the pelvic floor, the pelvic diaphragm is seen to form the inferior limit of the pelvic cavity. While inferiorly here, below the pelvic floor or the pelvic diaphragm is where we have the perineum. Anteriorly here at the front, we have the anteriorly placed urogenital triangle, while posteriorly behind, we have the anal triangle, just as what is presented here in the female perineum, as we described in the upper image. So within the anteriorly placed urogenital triangle is where we have the superficial and the deep perineal pouches. And we said that the basis onto which these pouches are created is the perineal membrane. So looking deep into this lower image, this is where we have the perineal membrane here, highlighted in red. and this is what is harrowed also here in red. So this perineal membrane is located within the anteriorly placed urogenital triangle. And it is onto the alignment of this perineal membrane that we have the deep and the superficial perineal pouches. The deep perineal pouch is what is captured here in black, and it is located above or superiorly to the perineal membrane. Just as the name implies, deep, it is located deep to the perineal membrane. While superficially here, that is captured also in black, is where we have the superficial perineal pouch. This is located superficial to the perineal membrane. So we see that the perineal membrane is the basis onto which these pouches are created, but are created within the anteriorly placed urogenital triangle. And this is what is seen here in this image. So within the deep perineal pouch is where we have the bulbourethral gland, and this is what is highlighted here in yellow. This bulbourethral gland, we say, can also be referred to as the Cowper's gland. You see it located on both sides of the urethra. Let's say this is the urethra here, highlighted in blue. We know that the urethra is what allows for the passage of the urine that is stored in the urinary bladder. The urinary bladder is located or contained within the pelvic cavity, and you have an exit structure that is referred to as the urethra that allows for the passage of urine through the penis. So you see this urethra running from this region down along the penis, where it finally releases the urine to the external environment. The urethra is not seen to only carry urine in male, it is also seen to help transport the semen. This is the difference between the urethra in male and also in female. So you see that this bulbourethral gland, that can also be referred to as a Cowper's gland, is located on both sides of the urethra, but within the deep perineal pouch. And this is what is captured here in this image. So these bulbourethral glands also are seen to have ducts, and it is through these ducts that they also release their secrets into the lumen of the urethra. This is where they help to clean and also lubricate the internal wall of the urethra, because the urethra is seen to carry urine and also semen. So before ejaculation, the internal wall of the urethra needs to be cleaned of urine. So you see that in terms of the functions that they exhibit in helping to clean and lubricate the internal wall of the urethra, which is also exhibited by the Bartholin's gland in female, that releases its content into the lumen of the vaginal canal, where it is helping to also lubricate the opening of the vaginal canal. So you see that they are homologous structure in terms of what they do. So now let's drive through into the lesser vestibular glands. Remember when we started this lecture, we said that the Bartholin's gland can also be referred to as a greater vestibular gland. We say because we have greater, we must have a lesser version of this gland. So the lesser vestibular glands can also be referred to as the Skene's glands. The lesser vestibular gland is a smaller version of the greater vestibular gland, just as the name implies. It's located in the vestibule, and you see it on both sides of the opening of the urethra. If you look at this upper image, this is where we say we have the Bartholin's gland. We have two, one on the right and also the other on the left. And this is where we have the opening of the vaginal canal. If you look at how the Bartholin's glands are located, you see that they are positioned laterally on both sides of the opening of the vaginal canal, although directed posteriorly. So if you go to the anterior region, here is where we have the opening of the urethra. On both sides of the urethra is where we have the lesser vestibular glands, and this is what is highlighted here in red. So you have two of these glands too. You have one on the right and you have the other one on the left. So you see that these glands are located on both sides of the urethra and are located between the urethra anteriorly and posteriorly. We have the vaginal canal. So this is where we have the opening of the vaginal canal behind this, while in the anterior region here, we have the opening of the urethra, while it is seen to be located on both lateral sides of the urethra. And what they do is to help lubricate the opening of the urethra. We say that the urethra opens into this region that is harrowed in white. So what they secrete helps to lubricate this region. It is also seen to present antimicrobial effects. The lesser vestibular gland is homologous to the prostate gland in male. Remember when we described the Bartholin's gland or the greater vestibular gland, we say that it is homologous to the bulbourethral glands or the Cowper's gland in male. For the lesser vestibular gland, the homologous structure in male is the prostate gland. And we'll use this slide to describe why it is the homologous structure of the lesser vestibular glands. If you try to use this lower image, this is where we have the pelvic cavity. We know that within the pelvic cavity, we have the urinary bladder. Inferior to the urinary bladder, we have the prostate gland. This is the prostate gland here, highlighted in red. It is located at the inferior region of the urinary bladder. And this structure that is highlighted here in blue is the urethra. We say that the urethra will finally allow for the passage of the urine that is stored in the urinary bladder. And this urethra is seen to course or pass through the penis before it is finally released to the outside. And the prostate gland will release its secrets also into the lumen of the urethra. And this is where it is helping to reconstitute the content of the semen. So let's look at the features that the prostate gland presents that allows for its similarities with the lesser vestibular gland in two respects. And first, because the lesser vestibular glands act as a source of female ejaculate. During orgasm, the lesser vestibular gland is believed to also contribute to the substance or secrets that is released during this process. And we know that the prostate gland also helps to reconstitute the ejaculate. Then secondly is the fact that the lesser vestibular glands and also the prostate gland have the same embryonic origin. So due to these two features, the prostate gland in male is seen as the homologous structure to the lesser vestibular glands. Now let's look at the clinical anatomy. So let's look at the Bartholin cyst. This is like a lump which extends into the vaginal canal, and this occurs as a result of obstruction of the Bartholin's duct. This can arise from infection or injury. Remember when we try to describe the Bartholin's gland or the greater vestibular gland, we say that these glands have ducts through which the secret is released into the lumen of the vaginal canal. So when you have obstruction of this duct, this can lead to the swelling of this gland. And you see this swelling extending into the lumen of the vaginal canal. If you go back to how this Bartholin's gland is positioned or located, you see that it is located on the lateral wall of the vaginal canal. So swellings exhibited by this gland will also extend into the lumen of the vaginal canal. And this can come with pain or discomfort. Major treatment options depends on how severe this swelling is. Antibiotics can be used or surgical procedure for fluid drainage. Thanks for watching. Let's continue to stay glued to this channel.